Hi, I'm Erik Lundgaard.
And I'm Danny Monar. Today we're going to be talking about environmental hazards within healthcare facilities specifically. So Erik is the CEO of MSC Environmental. Kind of tell the audience what we as a company do.
Well, there's a lot of different verticals that we work in every day, whether it's healthcare, insurance related, commercial, casino. I mean, the list goes on because environmental hazards affect all different types of verticals. But I think some of the things that we want to kind of relate to that clients don't really know is that there's a science to doing what we do. People call us for reasons. When you're dealing with environmental hazards and such as asbestos, lead, mold, sewage, water damage, and facilities, Legionella, when you take a healthcare facility, and that's specifically kind of what we're going to be talking, what vertical we're talking about today, so what are some of the things in that you think that we've experienced in a healthcare facility? Maybe just water line busting, they're remodeling the building, and putting in new rooms, or dealing with water intrusion, mold issues.
Yeah, a lot of the times, when you're working in something that's supposed to be super clean, like a hospital, you don't really think about asbestos in the walls, or things that need to be addressed in that type of situation. So we've gotten calls. Certain healthcare facilities, like an optical surgery center, they need us to test for particulates in the air because nothing can be floating around in the air when they're operating on some person's eye. So we test for that. There's a water loss, a toilet overflowing. We have to go and test for bacteria from the sewage, as well as mold. If the water was sitting there for a long time, mold could have grown. So these are all things that people that are susceptible to getting sick in hospitals, they're more at risk of getting sick from these hazards.
Yeah, and it depends where your facility's at. You've got the Midwest, which is a bunch of snow, cold all the time. You got the West, which is warm. You got the South, which is humid, and you got all these different elements. I remember doing an inspection one time in Las Vegas where we had snow on a medical facility, medical building, and it melted all inside of the structure. And you're like, and doctors are still operating, but it's all wet, and they're trying to figure out, like, we got to dry the structure down. We got to still operate. We still got to treat cancer patients. We still have to have an operating business. And a lot of times, too, those director of facilities and engineers need to have consultants like that on hand, or vendors already in the process to help facilitate that. And, when you're only pigeonholed to one consultant and you only know that they only know one vertical, maybe they only know hazardous drugs, maybe they don't know how to do, oversee a water loss, maybe they don't know how to deal with bacteria and sewage. You've gone on some different water losses using an infrared thermal imaging camera and kind of directing people. Tell us about your situation, because I know you've done whether it's high-rise buildings for colleges, you've done medical facilities, you've done senior living, and I know we're kind of jumping from different vertical to vertical, but tell me about your experience on that.
Yeah, and it's really all the same. A building's a building. A lot of the time, in case you guys don't know, it doesn't snow or rain in Las Vegas that often. So when it does, that's when people notice that their roof leaks. And a lot of the times they don't know how to handle it. So they call us to make sure that the water gets dried out effectively in a fast period of time, so that there isn't any microbial growth. Because if you leave things wet for a long period of time, things start to grow and the problem gets worse and gets more expensive.
Yeah, and you don't want to have mold in a facility to begin with. So a lot of times, from our experience, the healthcare facilities, if they have any potential mold that can get somebody that's already sick more sick, so they want to make sure it's sterile, it's clean, whether it's your cath labs or your facilities or your pharmacies or wherever you're working, your surgical centers within there. And depending on whether it's an old hospital or a new hospital, some of the older ones, they have black mastic flooring, removing that, or they're remodeling, adding, because people are getting sick more and more nowadays because they're maybe not eating well or just different challenges of life. So as these hospitals are growing and putting new wings on there, they're needing environmental consultants to help them, day in and day out.
Yeah, and even if the facilities managers in these healthcare facilities, they're keeping their building, in tip-top shape, there's also Legionella bacteria that could be growing in their water lines that they don't know about. And this is a big issue right now. And so Legionella bacteria, it grows everywhere pretty much, and there's more and more cases coming up as doctors are more effective at finding it. So, we can come in there and test your entire water system and, help you write a water management plan to prevent that as well. Which is something that kind of gets missed by a lot of facility managers.
Yeah, and you have a lot of experience doing that. I mean, just with your engineering background and understanding and interpretation from doing huge projects from soot, fire jobs, to doing, water bacteria sampling for asbestos and lead, indoor air quality contaminants. And so, I mean, so you can see a big picture of things where somebody may just have a limited view of that. And I think that kind of gives their overall benefit to a facility engineer or risk management. Reducing risk is, at the end of the day, reducing risk is really what they want to be doing. Mm-hmm. And I think I was going to touch on one other thing as far as I've had a couple sprinkler ends bust where I've actually gone in there and I've seen fungal growth in, cath lab areas and in ceiling structures, ceiling cavities that people have totally missed because a mitigation company didn't dry down the structure properly, or maybe if you've had hurricanes and tornadoes ripping things off. And we don't really have a lot of that in Las Vegas, but we've actually been able to help clients deal with those challenges in different markets.
Yeah, and a lot of clients, they're trusting these remediation contractors to do a good job. Unfortunately, sometimes that's not the case, and that's where we come in and we check their work, make sure everything's done properly, mm-hmm. and if it's not, we make the recommendations that need to be made to fix the problem.
And that's exactly, with the new USP 800 coming down for the healthcare facilities, and then adding that into our vertical of other service lines that we do, already existing USP 797, now 800. I think that a lot of our clients are going to be able to get the benefit of our education and knowledge. We're just in the industry as a whole. And so I think that you'll be highly impressed about, what MSE can do for your company. You can reach us on our website at mseenational.com. I think a lot of times people don't always know where to look. Google's a great source for that. I Google everything, just something like you do too. And I think just taking a company to the next level. Content education is very important. So hopefully what we're doing here is helping the end viewer.
Yeah, you can find us on Instagram, YouTube. We're making these podcasts for a reason. And then, check out our website. We have a lot of really good information on there. And, if you have any concerns about an environmental issue in your building, give us a call.
Okay, Danny, thanks. I appreciate your time today.
Thanks.